Welcome to our community. Susie Thomas here with you this morning. We are getting ready to move into the month of October, if you can even believe that. October not just being a fall month, but it's also Breast Cancer Awareness Month. So telling us all about that this morning is Dr. Rick Stjernholm. Good morning.
Good morning.
First of all, let's just get some misconceptions out of the way. May I call you Rick?
Sure, absolutely.
What is breast cancer?
Well, breast cancer is when a breast cancer cell or a tumor cell grows without the ability to stop itself. In most situations, we have a tumor cells that start in the body, but then our bodies have the innate God-given ability to stop that growth. A breast cancer, or any kind of cancer for that matter, is just an uncontrolled growth.
Is it different than other cancers? Does it behave differently in any way?
It behaves differently, but it's also different than other cancers primarily because of where it's located.
Okay.
Mm-hmm.
So we know that we go in for the exams and so forth. What is the best way to find it early? How do we do early detection? Because that's probably the key, right?
Yes, that's exactly the key, and that's a good question. And the bottom line is just to do, the appropriate screening that your primary care recommends to you, and just to go by those guidelines.
What should we watch for?
Well, for a mammogram, you'd be looking for something that would be an abnormal finding on a mammogram.
Mm-hmm.
But keep in mind that sometimes we see things on mammograms that we don't really know what they are. So I think it's important, if a doctor says, well, there's a spot on your mammogram, that we don't necessarily jump to the conclusion that it's a breast cancer or something necessarily. To that degree, but also when you're looking at mammograms, you want to know if there's a new finding, and sometimes we'll follow those findings, and sometimes we'll biopsy them. So that's I think the take home from that. And then certainly if there's ever a lump or a bump that one feels either on breast self exams or incidentally, those are good things to have checked out by your primary care physician.
Okay. I've also heard maybe change of color of anything. What kinds of other flags maybe we should be on the lookout for?
So with breast cancers, if you have, there's a couple things that you might see when you're looking in a mirror or even at yourself, that you might notice either reddening of the breast or some dimpling, or certainly if there's one spot that looks like it's inverted, or if there's new nipple inversion, or even nipple discharge sometimes can be an early sign, or particularly nipple discharge with bleeding.
Ooh, okay. Yeah, that would seem unusual, and that's when you want to call a doctor.
Correct, yes. Yeah.
Are there false positives? So there's
Absolutely.
you can have something show up on a mammogram and it's really nothing.
Correct.
Tell us about that.
And to that degree, they always put a disclaimer on the mammograms also that there are false negatives. So that's the unfortunate part about that, is that, they say that they'll miss about 10% of breast lesions on the initial mammogram or, screening annual mammogram, and that's why it's important to make sure that you get the periodic screening.
Okay. What puts us at risk, I guess? Are there things that we should not do that can lead to cancer?
There are things that put people at risk. Predominantly, those are ones that we can't control, and things like hereditary factors and race and history of that sort of thing. But I think in general, the things that we look at also are just exposure to what we call hormones, or estrogen and progesterone. Those are some things that can sometimes increase one's risk factors, and then also just I guess the some things that people can do as far as monitoring that or screening that would be also, breastfeeding is thought to be preventative. Also just healthy living, although it's not necessarily been proven, eating healthy, physical activity, not smoking, those aren't necessarily things that are known to prevent breast cancer. But I think all of those, again, just help the body to heal itself.
Okay, some things that I've been told help me either know if these are true or if this is just one of those fallacies that we've just been told. Hair dye. Does that lead to breast cancer?
Hair dye, to my knowledge, does not lead to breast cancer.
Okay, hormone therapy. I've got to tell you, you hit a certain birthday and you feel like these are my options because they're either saying you need hormone therapy, although, you will be higher at risk for cancer. So, no, I don't want to have all of these symptoms, and no, I don't want this either. So, help me out, Doc. What is the best thing? Can you take hormones without increasing your risk of breast cancer?
Yeah, and I think, again, to highlight, it's really important to talk to the primary care provider who's issuing those, and for them to know your history and for them to really tailor that specifically to you. But I think in general, when we talk about breast cancers, there are some that are at risk for becoming, growing based off of hormones in the body, and some that aren't. So I think in general, we consider taking hormones, or what we call exogenous, meaning hormones by mouth, taking a pill or a tablet that would increase one's risk for developing certain kinds of cancer.
And this would be the hormone replacement therapy that we're talking about.
Correct.
Okay. Deodorant.
Not that I know of. No.
Okay. Antiperspirant.
No, not that I know of.
Okay. Soy.
Soy? No, I have not heard of soy increasing one's breast cancer risk.
Seriously, I've been steering clear of all these things and didn't have to. Okay. Are there some things, though, that you say the biggest things are those that we can't control, hereditary?
Right.
First of all, how far back? What if your great-great-grandmother had breast cancer? Does that put you at risk, or is it more close in generation?
It's more close in generation, what we call first degree or even second degree relatives. So if a mom had breast cancer, or a sister has breast cancer, or even a daughter has breast cancer, then that's an increased risk right there. If it's an aunt or maternal aunt or something like that, then that also increases the risk, maybe slightly, but not as much. But decades ago and generations ago, not so much.
Decades ago and generations ago, you felt like you were getting a death sentence as soon as you heard this diagnosis. That's not the case now, is it?
It is not the case, and that's really an important point that I want to stress to people, that although breast cancer in women is one of the most highly diagnosed breast cancers, it's also one of the most treatable. And so I want to highlight that, because it's important that when someone gets this new diagnosis of breast cancer, that they're not thinking those thoughts right off the bat that, oh no, this is the end, or this is it for me. And that's certainly not the case. And we've come a long, long way in both treatments and outcomes as well. Before
we talk about some of those treatments, tell me again about prevention. I'm all about prevention. Is the best we can say don't smoke, or are there some other things we can do as far as healthy living to prevent breast cancer for as long as we can?
Sure. And again, I am stressing that, following primary care guidelines for screening, I think, is the best prevention that you can do as far as just monitoring, because when we catch a breast cancer and we catch it early, that's the best outcome that we can hope for. As I mentioned, breastfeeding is thought to be preventative. Also, if it's breastfeeding under age 30, that's shown to have been helpful as far as prevention. Limiting hormones we talked about, healthy living. There is some thought that obesity increases the risk of breast cancer, and the reason for that is because that even if we're what we call postmenopausal, we're not having our ovaries release, that time of the month anymore, but then we still have estrogens in the body that are converted outside in the bloodstream and so forth from fats, and so that's one of the reasons why it increases the risk. But also finding a lump. If a woman finds a lump in her breast, either on incidents or on self-examinations, it's really important to let a primary care know about that, because again, sometimes we think, oh, that's just something that's there, it'll go away, and then we tend to wait, and then the longer the time goes, it's harder it is to get in to see somebody. So I really encourage that and stress that if you find a new lump, just talk to your primary care doc
right away, because you are right. I think the inclination would be to really hope it's nothing, and you want to watch it for a while instead of jumping on that and taking care. Tell me why that would be the wrong thing to do.
Well, it may be nothing. That's always a possibility. But again, if you find something and you're afraid, that's often what happens. Is even for say a guy with a testicular cancer, they may find a lump on the testicle, and they may say, well, that's odd or that's weird, but I'm too embarrassed to go tell somebody, because the most frequent age range for testicular cancer is age 15 to 35.
Really?
And so these guys, they're young and they find a lump or something and they don't want to go tell their family doc because they're embarrassed. Well, the same thing can happen with the females, is they find a lump or something and, well, maybe they've never had a mammogram before, or maybe they've never even seen a doctor for something else. And so it's hard for them to muster up the courage to go see a doctor to find out what it actually is. And then there's an underlying fear that what if it is a cancer? And again, I would just really encourage the listeners that if early treatment's the best.
Mm-hmm. And also just to rule it out.
Correct.
Go get it checked so that the bad stuff can all be not one of your options that you have to be dealing with, and you find that out sooner, and then you're not worried for as long.
Exactly.
You mentioned men. Of course, it would be just uncomfortable for a young man to go get checked on any kind of a personal place as far as whether he's got cancer. Really embarrassing for a man to suspect that he has breast cancer.
Sure.
But this is not just a woman's problem, correct?
That's absolutely correct. The men with being diagnosed with breast cancer is very rare. It's 1% or less of all breast cancers, but again, it does happen, and to that degree, mostly it's in men who are in their 60s or 70s, and it usually presents as a one-sided lump or mass, and so forth. We do see some teenage guys and younger guys in the office from time to time that will have an enlarged breast, and we call that gynecomastia. And most often that's just due to hormonal changes in the body from guys growing up. But always happy to see those guys to reassure them as well. But mostly it's in the 60 to 70 age range for men that develop breast cancer. But they also can have surgery. They can also have treatment, and it can affect men just the same.
That's going to be the last thing a man thinks of when he
Sure.
discovers any kind of a lump. So what do we do to keep this on the top of the mind as far as people just being aware?
Mm-hmm. I think just in general, being aware of one's body, that if one finds a new lump or bump somewhere, to check it out.
Birth control, I've heard that might also, because that's playing with hormones
It's just
and
playing
so
with the
forth.
hormones,
Yeah,
correct.
that could be or put you more at risk. Yes or no?
Maybe just slightly.
Okay.
Maybe just slightly. But again, that's a personal, personal decision, and I don't know that if taking birth control for 1 or 2 years would ultimately make that big of a difference. But again, for someone who's using it long term, it might.
I have also heard that the younger a young person becomes sexually active, that puts them at risk because they are maybe on birth control. I'm reading your face. You're not
For
certain
breast
about that.
cancer specifically?
For breast cancer specifically, also cervical cancer and others as well.
Certainly for cervical cancer, that's without a doubt. I'm trying to think if that would increase breast cancer, and
I'm thinking maybe it's because of being on birth control so early.
Yeah, so that's a good point. And one of those risk factors, again, would be the longer one's exposed to the estrogens in the body and the progesterones in the body. And that goes along with early menarche. So some women, if you earlier onset of menses, 10, 11 instead of the 12 or 13 that's usual, and or late menarche would be after age 51 or 52. So again, the exposure to estrogen. So I may have misspoke there, but early onset of menses and late menarche. So the longer you're exposed to the estrogens.
Oh, that is such terrible news for so many people. So
I know. It's a double whammy, I know.
It is. It's like really not fair. It's on both ends of the scale. Yeah. We're speaking with Dr. Rick Sternholm. He's from, tell me where you are from again.
So I'm with Surgical Associates of Canton. We're a group of 3 board-certified general surgeons, and we're in private practice group here in Canton. We do go to Altman, Mercy, and Affinity, and we are used to seeing these types of patients in the office.
We are going to find out what kinds of treatments are available now. Things have changed. It's a lot better news. But first, we've got these words. You're listening to Our Community.